if you can come on, oh, 1 second. If you can come on camera, I would appreciate, so that I don't feel like I am alone. Thank you, Edith. Thank you so much. That's amazing. It feels good when you have somebody, at least you can see another face. You don't always feel like you're talking to yourself. So what I'm going to do is I am going to share my screen. Edith, if you can let me know what you can see on the screen share that I'm sharing. Yeah, perfect. Thank you. She's given me the thumbs up. Thank you, Betty, for coming on as well. Amazing. I love it. Now, so today we are talking about how to be a menopause warrior and not worry. And actually, I don't like own that tagline. I borrowed it from one of us here. Her name is Monigo, but she talks about peri-menopause warriors. But I'm talking about menopause as a transition period, not just as the actual menopause, because as you see, menopause is just one day. So, Monico, thank you for inspiring me. And so we're going to talk about how to be a warrior and not be worrying about it and losing your sleep about it and becoming so concerned and letting it consume you and overwhelm you, right? But before I do that, who am I? Let me introduce myself, because there's so many new people here who I am so glad that you have joined us and you found us. So my name is Yunis Ogada. I am a mother. I am a wife. I am a servant of God first and foremost. That is my biggest purpose in life. I am a Christian. I'm doing life with Jesus. My biggest mission is to make it to heaven. And my second biggest mission is to serve God by serving man. And that's why we are here today. That's why we are doing this today. From a professional background, or let me give you a little bit of a story. I was born in Kenya. I went to primary school in Kenya. I went to high school in Kenya. And then I came to UK immediately after high school. And I was, I think, 18, 19. And I came to study medicine because I had always wanted to be a doctor. But then I had a rude awakening when I got here. They said, yeah, you can do medicine. We just need 41 grand from you every year for 6 years. I was like, what? So, of course, it was an unachievable goal at that point because we didn't have that kind of money. I didn't have that kind of money. My family didn't have that kind of money. And so I decided I had to do something that was within my reach. And so I chose to do physiotherapy because I had some experience in physiotherapy whilst I was in Kenya. So I did physiotherapy. I decided you've given me lemons, I might as well make lemonades from my lemons. So I made lemonade. I sold it at Starbucks price, not at mediocre price. So I went all in. I did my undergraduate. I did 2 postgraduates in it. I did joint injection. I did independent prescriber. So basically, I went to every level you can go in physiotherapy. You would call me an advanced physiotherapist because I can do everything. I can assess, I can diagnose, I can prescribe. Need to meet someone. I can inject joints. So for example, people with arthritis, sometimes they need an injection in their joints, so I can do all that. However, because physiotherapy isn't really what I had always wanted to do, I was still not content. So when I became a resident in the United Kingdom, I live in UK right now. And obviously it takes a process before you become resident. So when I became resident, I was like, oh, well, now I can go back and I can do graduate entry medicine, which would have taken me 4 years. And of course, I would have been able to get funding from the government to do it. But I had at that point already started working at a GP surgery. So in the local surgery or the local hospital or clinic, I don't know how to put it. For those who are not in the UK, it's like your local clinic. Like every area has a local clinic where the people in that area are like serviced by that clinic. So I could see that they only had maximum 10 to 15 minutes to see a patient. So the only thing they could do is really prescribe, because they just have not been, the system does not give them enough time to see you and get to the root of all the things that can cause diseases. And that for me didn't sit well with me, because I understood it's not their fault, it's a system fault. However, I had to then make a decision of, this is what the system is. Do I want to go back to school for 4 years and come and do that? And that didn't sit well with me. So I decided I needed to look for something else. And that's when I found something called functional medicine. And functional medicine is not very common in a lot of places, especially in the UK. It's starting to get a bit more popular, because a lot of clinicians are going to America, doing the course, and then coming back and now practicing it. For example, like say somebody like Ragan Chatterjee, he went and did it in America, and then he came back. Now he has a clinic. He's teaching that. Like he's got I think a course on lifestyle medicine now. So it's starting to become popular. But functional medicine, what it does, it doesn't address the symptoms. It addresses the root. So why do you have these symptoms in the first place? It's not about you having the symptoms. It's not about you having a diagnosis. It's about, why did you get that diagnosis? If you have diabetes, as an example, instead of dealing with the diabetic symptoms, is looking at, why did you become diabetic? Right? Of course, we know diabetic is caused by insulin resistance. So why did you become insulin resistant? Right? So reversing and pulling out the roots to make sure that now you're getting rid of the symptoms and you're getting rid of the diagnosis and the diseases. So as a result, I also did a course in lifestyle medicine, because of course I am a healthy life specialist, because I help people with their lifestyle. I did nutritional course, although that was also covered in the functional medicine, but I did a separate nutritional course. So it's about really equipping myself to be able to provide my clients with the best service that they deserve. Now, why are we doing this session today? We're doing this session today because, first of all, one of the things that we need is hormonal literacy. When you went to school, they taught you literacy and numeracy, right? But one of the things that unfortunately we lack is hormonal literacy, where we now understand how our hormones change from the moment we're in our mother's womb all the way to the moment we die. And that, for us women, is so significant, because once we go through that transition of peri-menopause, menopause, and postmenopause, there's so much change that happens from a hormonal perspective, but it doesn't just affect our hormones, it affects the rest of our health until we die, right? And it also impacts on how the quality of that life is going to be, and it also impacts whether you'll die early or not. So don't just look at perimenopause and menopause as just something that we go through. It is something that has profound significance for the whole of your health. And I'm hoping that if there's one thing I want you to take away today, is how important this transition is for the rest of your life. It's not just about going through it, but what does it actually mean as far as your health is concerned? There's so many symptoms of it. We might not be able to go through all of it, but I have highlighted some of the important ones that I think a lot of people don't realize are related to it, but hopefully we can be able to go through it. Now, I want you to take back your power. When you have awareness, when you have education, when you understand the choices you have the power to make an informed choice for your body, for your health. That's important. And especially for me, it's really important for women to be able to take back their power. I want you to rebuild the trust with your body, because when you understand what is happening with your body, you learn to have that relationship with your body. Self-relationship is so important. Relating with your body, so you're not hating on your body, but that body is the body that has been serving you all this year and will continue to serve you. I want you to have a better relationship with your body. I want you to understand that your health doesn't only come from your doctor, and I say general practitioner, GP stands for general practitioner. It doesn't only come from your doctor, it comes from you being empowered and understanding what are the different sources of help and support that I can be able to get. Because I think a lot of people only depend on their doctors, but they don't realize that there's so much help outside of your doctor, right? And one of the things that I want us to understand is how much this change, like what is the difference between us as women going through this change and what the men go through it. You will see like there's so many things that changes in our health that our men, lucky for them, do not have to go through it. But before I tell you too much more, I'd like to first of all introduce you to Jael. Jael is one of my clients, and she's just a short testimonial, very 2 minutes testimonial. So you can actually hear from her, and you're able to see what I have been able to achieve with some of my clients. This is just some. So I'll play the video now.
Hello, allow me to share with you my journey.
Can you hear it?
Hello, allow me to share with you my journey briefly. So earlier this year, I went to hospital. I'd gone for a checkup because my periods had not come from September 2021. And had seen different specialists who were telling me everything is okay. However, my periods were not coming. So this time around, the doctors decided to do a hormonal profile. And when the results came out, my FSH levels were very high. And the doctor explained that that meant that I was experiencing early menopause because I'm 36. And yes, from the results, it was indicative of early menopause. So I have been on this program from mid-February, and I have worked with Yunis since. So there are things that I was learning, there are changes that I was making about my lifestyle, my choices in terms of food, exercise, and stress management and the like. So what happened is on 1st of April, my periods came. And it's exciting because they were not painful, they were not heavy. I normally used to have very, very heavy and painful periods where I would miss work or days off from school because of the pain. I had to go to hospital. I had to be given very powerful painkillers because of how painful it was. But this time around came nothing. In May, my periods also came. No pain, not heavy, no bloating, no irritability, no hormonal acne, nothing of that sort. So I am excited about this journey. I'm excited about the changes that I'm seeing in my body. I'm excited to see where when I end the year, how my body will be. So thank you so much, Yunis.
Amazing. So this is
hello.
I'll see if I can move forward. That's her testimony, and that's what happened to her within 2 months. And now her periods are regular. It's no longer a thing. So, when you pull the root, even though the doctors had actually told her that she was going through early menopause, when you pull the root, you can reverse things that you've been told that, oh, it's past reversal. Because when you pull the root, the symptoms have to disappear. The fruit has to disappear. You can't have fruit without a root. So that's what we do. Now, menopause is inevitable. How you handle it isn't. It's all about how we handle it. And I say we because I'm also, I'm soon going to be in the peri-menopause category, right? 7 out of 10 women blame menopause for their divorce. And like in the UK, 60% of divorces are initiated by women in their 40s, 50s, and 60s. Why? Because at that time, there's so many changes that are going through a woman's body from that transition that we as a society don't know how to handle our women. So as a result, they feel unsupported. They struggle with even things like relationships and marriages. And as a result, we are finding that they are talking like this lady. I don't think you understand how these hormones work. You're gonna make me do something that will end up in the news, right? Because that's how the women are feeling whilst they're going through those moments. Because there's so many things that are happening, and the thing is, they are all happening at the same time. And women, there is like a big picture of women who are over the age of 40 who are on antidepressants. Why? Because there is a 40% increase of mental health diagnosis and risk of mental health illnesses just from going through that transition. So a lot of women are having to go on antidepressants because of the mental health issues, right? And up to 25% after the age of 60. So they're not just getting into, having to use antidepressants just for that period of time. And then we label them, oh, it's just hormones. They're hormonal, they're hormonal, they're hormonal. But we don't really sit and actually understand exactly what is going on with this woman. Your hormonal system works like an orchestra. In an orchestra, you have all these people who play all these different instruments. And you have a conductor, and a conductor, where's my pen? A conductor has a cane. The conductor is your hypothalamus. The cane is the pituitary. And the instrument is the different organs and other glands that now the information is sent to. Because when your conductor says, this side goes, stop, you pick up, you stop, that's what your brain and your hypothalamus does, where your endocrine system is concerned. And your endocrine system is the system where all your hormones are produced and work. When we are looking at how your hormones work, we call that the endocrine system. Now, but before we talk about menopause, it's obviously very important for us to understand where did it start. So, and I think this is something that might shock some of you. So I want us to be interactive. I don't want to talk by myself. We are in it together. So please talk to me. Now, did you guys know that you have the most of your eggs whilst you are 20 weeks in your mother's womb? When your mother was 20 weeks pregnant with you, that's the time when you had the most, your full amount of eggs that you will ever have in your life. Let me know. Put it in the chat. Let's have a conversation, guys. Don't leave me here hanging by myself. Did you know that you had all your eggs, about 3 to 4 million eggs, whilst you were 20 weeks old in your mother's womb? By the time you were born, your eggs had started deteriorating and you had started losing them. So by the time you're born, you have 1 to 2 million. By the time you hit puberty and you start ovulating and having a menstrual cycle, every cycle, you're losing 11,000 eggs. Even though only one gets to maturity, all the eggs that the follicles that get made, for only one to make it out of that is 11,000 eggs. And then, oh, I think some people are just sending me a message, and ignore the noises if they come. I think somebody's sending me, responding to the WhatsApp messages, and I don't know how to shut it off, right? By the time you are in your 30s, you now have only 10% of your eggs. So if you are in that category of 30 to 40 and you have not had a baby, I think it is high time you start thinking about freezing your eggs, because your egg quantity and quality is deteriorating as we age. So by the time you hit your 40s, you only have 3% of your eggs. Guys, talk to me. Did you know that? Alice didn't know. Yes, yes, yeah. Yeah, they decreased that much, exactly, right? When I worked that out, that was quite surprising for me. I was like, oh my God, women need to know this, because when a woman does not know this, she cannot make that informed choice, which is what I was talking about earlier. If you knew that the eggs are deteriorating at this kind of rate, now you start having those kind of conversations about things like freezing your eggs. And guess what? When you freeze your eggs, they have a 90% chance of survival, which is better than what it used to be. It used to be like 10 to 20%. So this is important. This is huge. This is good to know this, because it now puts power in your hands to now make an informed choice. And I having this conversation with one of my friends, and I was like, you know, we don't realize how quickly they deteriorate, and not only the quantity, also the quality. That's why you find when women have children over the age of 40, and I'm not saying you can't have children over the age of 40, you still have 3% of your eggs. The quality of your eggs, however, is poorer. You get more chromosomal changes, so the quality deteriorates as the quantity goes down, right? And you find that, especially like say in the UK, when women get pregnant over the age of 40, and especially these days with like the ethnic minorities, they are getting them to be seen by a consultant quite regularly because they have to really keep an eye on them, because the risk of miscarriage is much higher. And also like the risk of complications is much higher because of the quality issues that are happening. You see, it's very different for a man. A man makes sperm every 90 days. A woman, we are born with all the eggs we will ever have. And as they decline, that's when now the changes in our bodies happen, right? But menopause really is just, it represents the end of your ovarian function. Ovarian function being that you don't have any more eggs, you've run out of eggs, so you are no longer able to ovulate. And as a result of not being able to ovulate because you no longer have any eggs left, you're not producing enough estrogen and progesterone in your body. So now you're not having that regular period. That's why the period stops. And most of the women, 95% of the women will have their final period between the age of 44 to 54. Now, that varies according to your ethnicity. For example, Indians, they go through menopause at the age of 46 and 47. Black women go through menopause at the age of 49. Caucasian women, sometimes they go through it at the age of 51, 50, right? So your ethnicity also matters. Your genetics, yes, matter, but also your ethnicity matters a lot. What are the things that you can do that can increase that chipping away of your eggs? If you have a hysterectomy, of course, that then takes away your ovaries and your uterus. So, I think that one goes without saying. If you have a hysterectomy, you lose 4.5 years of the shelf life of your ovaries, right? If you have one ovary removed, then you lose 1.5 years. If you are of African genetics like me, you lose 2 years and go through it younger. And unfortunately, the Black people and the Black women, they seem to have the most severe of the symptoms. Yes, it's not fair. But guess what, guys? It is what it is. We need to know this so that it's not finding us by surprise. If you are a smoker, you lose 2 years. If you have chemotherapy or have abdominal surgery, of course, that we call that medically induced menopause. So you will go through it at whatever age you have that done, right? So it's not always that it will come earlier. Sometimes you just have that surgery or the chemo done, and immediately, bam, you go through it because it's just that interference with the system and how it's supposed to work. The age of menopause is definitely genetic. Unfortunately, like, I don't know when my mom went through it. I have no idea. Unfortunately, my mom died when I was 12, so I don't even get the chance to go and ask her, oh, mom, by the way, when did you go through it? And also, a lot of our mothers, they never talk about this thing. So we don't know. But if your mother is alive, you could go and ask her, what age did you go through it? Because chances are, if your mother went through it very early, if she had it prematurely, the likelihood that you too will is very, very high. It's quite highly genetic. I'll just mute you, Sarah. All right. Now, I just want us to have a look at, because we've looked at the egg, let's just have a look at what are the different stages. So the first stage is from the time a girl starts having periods at whatever the age is. It used to be like anything from 12 to 15, but these days it has gone down to like sometimes even 8, because unfortunately there's so many underlying root causes of that the girls are now starting to have periods way too early, right? We have pre-menopause, which is between the age of when you start your periods to the age of about 40. right? Sometimes 35, it depends, could be that 40, could be 45, could be 35. Then we have peri-menopause. Peri-menopause is now that stage from the moment now you know, with that significant decline in your egg volume from that 10% going all the way to the point where you have 0 eggs. Menopause is just basically marking that is like a date or an anniversary that marks the time from when you stopped having a period for 12 months consecutively. Now, it is not the most perfect measure because for women, say, for example, who has polycystic ovarian syndrome or insufficiency, menstrual insufficiencies, and different things, different causes that cause them not to have a regular period, it can be hard for them to know how long that is because obviously their period was so irregular that they might not know when this 1 year was marked. And then when we now say you've not had periods for exactly 12 months consecutively, then from that moment on, you're postmenopausal until you die, right? So it's that moment where, like, menopause is not really the period, although we always talk about menopause as the whole period, perimenopause, menopause, and postmenopause, but they do have different classifications and differences in the different stages. Please, guys, talk. Is freezing of eggs done in Kenya? That is a very good question. I would like to say yes. I'm sure if there's any fertility clinics in Kenya, then they must also be doing that. So I would like to believe that yes, they have and they are, but I don't have any specific information as of right now. But if anybody here has any information, please share. This is why we're here, so we can all share, right? Alice says, why are we not taught this in school? That is a good question, but school doesn't always teach you everything you need to know. It's just like the way school doesn't teach you how to deal with your money, right? Yeah, I think, what's that? Betty says, now I don't feel so bad for having my kids early. Betty, I had my first one when I was 31 and my second one when I was 33. I feel the same way, right? I understand. I think sometimes it can be looked at like, if you had your kids in your early 20s, sometimes, like, you know, society really looks at you badly, like you are, you know, naughty, for lack of a better word. But actually, when you look at it from an egg quality, egg quantity point, you can see why having this information makes you be in a position to make an informed choice of when do you actually want to have children, obviously everything lining up. Yes, so you had yours in 21, 25, and 30. Wow, you are very good at that spacing. Very bang on with the spacing. Okay, right, so please keep the comments coming. Let's all have that conversation. Now, this is one that we all need to participate, unless you are a man. But if you are a man, I'm sure you have a woman, that's why you're here, so you could score for her, right? Please take a moment and do this and put in the chat what your score is. Everybody will have a score. Even if your score is 0, it's still a score, right? So do a score, put it in the chat what your score is. So you're scoring it from symptoms 1 for mild, 2 for moderate, 3 for severe, and 0 if you don't have that symptom at all. I sent this to one of my friends. She scored 7. And the reason I'm getting you to do this is so that we can be able to have... Oh, there you go. Somebody has put apples and cents, Harley Street. Oh, there's Harley Street in Kenya as well. Harley Street is a very expensive place here. Harley Street, I bet you they got it from that part in London. Harley Street, and there's Dr. Murage, 0780-256-256. There you go. There's the number. Thank you. Thank you, Betty. Perfect. See, it's good to share this information. Yeah, Fatima says it's done as well. Perfect. And I'm sure that's not the only place. I'm sure there will be other, you know, places and doctors. But thank you for sharing that. That's important. So we're just scoring our symptoms now.
That kid is great.
Welcome, Sibo. We are scoring ourselves, so come and score yourself what symptoms you may or may not have. It's 1 for mild if the symptom is mild, 2 if the symptom is moderate, and 3 if the symptom is severe. Like I said, if you're of African ethnicity or Black American, Black British, whatever, Black other, you will probably have more severe symptoms. And that's just to do with our genetics. So if you have hot flashes, lightheaded feelings, headaches, irritability, depression, whether it's been diagnosed or not, you know, unloved feelings, anxiety, sleeplessness, mood changes, unusual tiredness, backache, joint pain.
Does not want to be there, and her friends say
We haven't searched. Well,
Olive and Mama Maggie, we are scoring ourselves, so please don't talk. Let's score ourselves. Dry skin, if you have new facial hair, or crawling under the skin, you have less sexual feelings, so lower libido, dry vagina, uncomfortable intercourse, and urinary frequency. So there's 23 of us. Come on, guys. So let's see your scores. 17, yeah, somebody scored 17. Yeah, total the whole amount. Yes, total the whole lot. Yes, thank you. Yeah. 7, yeah. Very consistent. $28, yeah. Yeah, 3. That's okay. You got what you got is what you got. Don't worry about what, why. Yeah. Okay. So the reason I'm getting you guys to do this, explain crawling feeling under the skin. You feel like you have ants that are crawling under your skin. You could call it altered sensation. It's like when you have like an ant on your leg or on your the way you feel when it's like crawling on you. I tell you, perimenopause brings many things that you'd never associate with. Who knew crawling under the skin is a thing? You know, in my physiotherapy world, if you told me that you have a sensation of crawling under the skin, I'll tell you have an issue with your nervous system, your sciatic nerve or your nerves in the arms, because we call that altered sensation. But guess what? How many people came and saw me back in the days as a physio and told me they had that? And actually, the problem wasn't that they had a radiculopathy or a compression of their nerve. It was just that they were perimenopausal. I didn't know. So I treated them for a radiculopathy when actually it was not a radiculopathy. It was a perimenopausal issue, right? Similar thing with things like you will see, we'll talk about it later, something like frozen shoulder. Yeah, these are few. They are not all, by the way. This is just something that like a standardized way of what the doctors can use to work out whether you're going through this, because there is no specific diagnosis as such. It's like a diagnostic tool as such. Now, why did I get you to do that? I got you to do that. Yes, yes, frozen shoulder. Yes, we are coming to it in a bit, right? What I want you to understand is the higher your score, the more likelihood that you are actually going through it. You are in that phase, right? If you scored anything above 11, right? Anything above 11 tends to be that you are actually perimenopausal. So those of you that scored 3 and 7s, it could be that if you scored 7, then you know you're not so far away from 11. So you're on the borderline. Yeah, it's coming. But it's not just about it coming. It's about you knowing how this is likely to impact you and, you know, affect you. Now, this is how, so when you talk about the endocrine system, we always talk about axis. So the axis is given a name based on the structures involved. H is for hypothalamus. P is for pituitary. G is for your gonads. If you're a man, your gonads will be your testicles. If you're a woman, then your gonads are your ovaries, right? As a woman, you produce mainly progesterone, estrogen. You do produce testosterone, but it is not one of the highest hormones. However, when you go through perimenopause or menopause, your testosterone also does decline. So it's not just your estrogen, progesterone only. However, we focus mainly on the estrogen and the progesterone because they are the ones that have the biggest impact on you and your health. When they are high, when they are low, that will have a different impact. And of course, everything starts from your hypothalamus, then it goes to your pituitary. This is your pituitary here, looks like this. And then, so the hypothalamus, pituitary, and then straight to the ovaries. So your every instruction that comes through is coming from your brain, from that hypothalamus. And what happens is, this is your cycle, right? For those of you that are no longer having the cycle, this used to be your cycle. For those of us that are still cycling, this is our cycle. So 28 days is a textbook woman. Not every woman has a 28-day cycle. A healthy cycle varies from 28 days to 34. That is normal, but it has to be standard. So you can't be doing 28 one time and 34 one time and 30 one time. That's still irregular. It needs to be like 1 day plus or minus, right? Could be 1 day plus or minus. So that's a normal range. So if you have one that goes 26, 1 day 29, 1 day 34, that is showing that you have hormonal imbalances and there's a reason for it. And that reason needs to be identified. Now, you have your egg and your follicle that starts developing. And one will be chosen to go through to the maturation age, despite the fact that at this stage you have like 11,000, right? So the fact that you're here means you won. Between 11,000 eggs, you were the egg that was chosen to go to maturity. You are the egg that won that race. So you already are a winner. You are a winner, right? You won on the egg side and you won on the sperm side. You're a winner. Then as it goes through to day 14, this follicle here, which is like a cyst, is a cyst. It ruptures, the egg comes out, and this structure that is left is called a corpus luteum. The corpus luteum becomes an endocrine gland that now produces your progesterone. So here, your ovaries will be producing lots of estrogen, because estrogen peaks just before here, and I'll show you on the next slide. Then so here you have your follicle stimulating hormone, and that's why we call this follicular phase, because you're growing the follicle, right? And then the luteal phase, now you're growing the endometrial lining in preparation for a fertilized egg being implanted. So that's why. But
have the time. We could take the time. Some people have, they.
Sorry, Tanya, I'm gonna mute you. So when you have the ovulation, that's the time now you produce the progesterone, because that's the gland that produces progesterone. So if you don't ovulate, you don't produce progesterone. The only other, because there's progesterone that is produced by your adrenals, there's estrogen that is produced by your adrenals, but the majority of your progesterone and estrogen are produced in your ovaries when you are still having eggs that are being released and you're ovulating. Now, so this is what I was talking about. This is the period you can see the endometrial lining is shedding. And during that time, all the hormones tend to be low, the progesterone, the estrogen. And as you shed, your brain is always sensing and checking to see how much estrogen is there in the system, because you have estrogen and progesterone receptors all over your body. But your brain, your hypothalamus is always checking. It's like a sensor is checking how much do we have. When it knows that it's gone low, because you can see here during your period it's low, it sends a message to your pituitary saying, can we start getting some follicles going? Can we start getting prepared for ovulation? Because the estrogen is a bit too low. So now the ovaries start producing the estrogen, and as the estrogen comes up, you can see the follicle stimulating hormone goes up a little bit and then it starts coming down, because we want to only pick one that will now go to the ovulation. Luteinizing hormone has to peak significantly for the ovulation to happen, and then it goes flat for the rest of the month. Same thing with the follicle stimulating hormone, it goes flat. But you see, estrogen peaks the highest during the first half, and then because of that corpus luteum that was now produced as a result of the ovulation, now your progesterone goes up because it gets produced. But because, I'll just go back. Can you see the corpus luteum gets smaller and smaller and smaller? The smaller it gets, the less progesterone it produces, and that's why you start having this curve going down. And as it goes down, then of course you start your period all over again. So you can see this is an orchestra. This is what I was saying to you earlier. Everybody comes in at the right time for the right length of time, and then they switch and they go and they do different things. So if we have issues with any of this, that creates a problem. What happens when you now have less eggs is the hypothalamus is sensing there's low estrogen. It's sending a message to the pituitary saying, come on, do something, send a message to follicle stimulating hormone to increase the production of the follicles, so that we can also, the follicles are what produces the estrogen. So that we can get some estrogen to come up. But then the ovary is like, guys, I don't have enough eggs. I'm struggling over here. So as it's saying I'm struggling, it's like the message is going back to say the estrogen is still low. So hypothalamus is like, come on, guys, what's going on? So they're like, I sent a message. It's like, send more. So the follicle stimulating hormone goes up. So now you find the follicle stimulating hormone is quite high, which is what my client Jael was saying, that her FSH was very high. That's why they were telling her you're going through early menopause, because when you're going through early menopause, your FSH is quite high because your pituitary is constantly trying to send the message to get you to actually get that egg. And then the ovary is like, okay, then push. Then it pushes that egg. It gets that estrogen up, pushes that egg. You then ovulate. But the problem is, because of all this back and forth, sometimes the cycle will end up being long, or sometimes the cycle will end up being short. So this is where you now start having that irregularity during the peri-menopause phase. And that's why, because of all these changes that are going up and down, then you have all between having a nice cyclical, oh, don't do that to me. Since my internet is unstable, I hope you can all still see me, hear me. I had to restart my router because it was playing up, so hopefully not. So you can start to see how this happens and what now changes to now make your cycle different, to make your cycle not work the right way, to make it a difficult thing, right? Where you're having all these symptoms, you're struggling, and a lot of things are happening. So we have peri-menopause. That's the phase where now the egg count has gone down, and now we are having all these changes. And that's why I'll show you in one of the slides later on. You will see that progesterone tends to come down much more evenly, because progesterone will only come up if you ovulated. Because at that time you start having a lot of anovulatory cycles, you start having very low progesterone, but the estrogen is like up and down. It's like a hormonal chaos going on, especially where estrogen is concerned. And that's what brings on the hormones, the symptoms that a lot of people go through. I explained what menopause is, so I'm not going to go back there. And then postmenopause is basically the period after you've had that 12 months of not having a period. From there onwards, you're postmenopausal, right? And some people's symptoms might continue even during the postmenopausal period, but not always. Some people's symptoms will cease, and some people's symptoms might carry on for a bit longer. It also is determined by what other things are going on in your body. For example, if you have insulin resistance, then that insulin resistance will now interfere with the production of the estrogen and progesterone in your adrenals. And then that now causes other problems that causes those symptoms to prolong. Now, would you go and have a blood test during that period of peri-menopause? Guys, if you have any questions, please don't be quiet. Keep them coming. Let's see if there's any. My cycle ranges between 25 and 28 days. Should I be worried? So 25, if it's 25 days, that means it's a short cycle. So you're having a shorter either luteal phase or you're having a shorter follicular phase. Most of the time, it tends to be more the luteal phase that changes. So it does sound like there is some imbalances there that needs to be addressed, right? What if your cycle consistently 21 to 24 days? It depends with what age are you. Are you in perimenopause? Because that can happen in perimenopause. You might have a normal cycle for all these years, and then you get into perimenopause, and bam, your cycle gets shorter, right? It's something that one of my friends actually asked me, because their cycle has become shorter. They're having a shorter cycle now. It happens in perimenopause, and like I said, it's because of all that hormonal chaos that goes on. But if you are in pre-menopause, like that age from puberty to the perimenopause age, and you're having a cycle of 21 to 24 days, you need to get help. There's an underlying issue, and that's not a normal period. Guys, remember one thing when we're talking about hormones. Just because something is common does not make it normal, right? What if you're already there but working on reducing the symptoms? So we will talk about that, right? So if you went and had a blood test done, the blood test will not show the right answers. Why? Because we said this is a hormonal chaos period. So if you're having a lot of imbalances, fluctuations, because remember, it's not just fluctuating from day to day, it's fluctuating from minute to minute, hour to hour, So you can have a blood test at this hour, and then you have another blood test at a different hour, and it will show you to one extreme to another extreme, because it's really a zone of hormonal chaos. And I'll show you, I think I have a slide showing you that, right? But having a blood test can be able to rule out other causes of similar symptoms of something. Say, for example, if you have hypothyroidism, if you have autoimmune, if you have nutritional deficiencies. I think one of my friends sent me a video, and I put it up, and I said, don't just blame perimenopause for all your symptoms. Some of the symptoms could be to do with your nutritional status. So if you have nutritional deficiencies, you could have similar symptoms to what people would be saying, oh, what do you have? You have perimenopause or menopause. So it's always important that, so your doctor doesn't necessarily need to do blood tests to check your hormonal levels, but they can do, say, for example, hormonal levels. They could check your thyroid hormone, a hormonal panel, a thyroid panel, sorry. They could do that, but you want to make sure that they have ruled out every other thing that could be causing it before you say it is perimenopause, right? So in that time, you're not looking at the estrogen, testosterone, progesterone, because it really is a period of hormonal chaos. Testosterone does decline, but it never goes to zero. So it drops a bit, but it does get to a stable level, right? This is what I was talking about, the hormonal chaos. This is you here. You're nice and 25, living the life. You get to about 35, because remember, this is to do with the amount of eggs that you have. This is why the decline starts going down, because now you're having less ovulations. So they start coming down, but you can see the progesterone is not as crazy as estrogen. Can you see estrogen? This is when I say hormonal chaos, this is what I mean. 1 minute it's down, this could be 9 a.m., this could be 10 a.m., right? So it's minute to minute, hour to hour. It's not just that. So it's so rapid, it's so random, it's so all over the place. And then it gets to a place where it now evens out and it's not so bad. You can see your testosterone does come down, but it's quite a nice linear curve. It's not as bad. Your sleep hormone, melatonin, it's nice going. You get to about 40. So you can see from here, like around 40. And then you start wondering what's happened to your sleep. This is what's happened to your sleep. It's going down. Then it levels out, right? So you can see this is your DHEA, this is your human growth hormone. But some of these hormones, especially like human growth hormone, are things that you can do something about with your lifestyle. You can bring it up with things like exercise, things like intermittent fasting. So there's things you can do that can make it better. But this slide is basically explaining to you what I've just explained about how the systems work, from the hypothalamus to the pituitary to the ovaries, follicle stimulating hormone, estrogen, ovulation, progesterone. Remember, if you don't ovulate, you don't produce progesterone, right? But estrogen especially is what we're going to look at a lot, because it has a lot of jobs in the body, right? And I'll show you another slide that kind of summarizes that. But it has a lot of jobs. So what happens to you is when you start going through the menopause phase, you start having issues with things like osteoporosis, brittle bones. Now you cough and you break a rib. You slide, you break a spinal bone, right? Your risk for coronary artery disease, so your risk of things like a stroke and heart disease, goes up just by you losing estrogen. You become insulin resistant because estrogen has a protective factor against insulin resistance. That's why you tend to find, as women go through that phase, they used to have a nice pear shape where all the fat was subcutaneous and was in the hips and the bum and the thighs, but that weight shifts up and goes into a muffin top. So the reason you're having the muffin top is because you've lost estrogen. Estrogen tells your body, go store the fat in the boobs, go stop the fat in the hips, in the bum, in the thighs, yeah, in the bingo wings. But estrogen is no longer doing that because estrogen is out. So guess what? Who's taking over? Insulin's taking over. So now you start getting insulin resistance. You start getting that visceral fat. Basically, you are becoming like a man. Can you see? Do you guys see where the men store their fat? In the belly. That is exactly what is happening to us as we are going through that. And then we are suffering and we are struggling with all these things, not understanding what is actually going on. Unfortunately, another thing that will happen is your mental health will change because you have estrogen receptors in your brain. And now the inflammation in the brain goes up, forming plaques that can cause you to now have Alzheimer's and dementia. And we will look at that a bit later. So the risk for women goes up with age, right? Then there's something called sarcopenia, which is the loss of muscle mass. You start losing your muscle mass. As you lose your muscle mass, that's why you get osteoporosis, because you lose muscle mass. Muscle and bone come together. They are a unit. They are a married couple. You can't put them apart. If your muscle mass goes down, so will your bone mass. And that's why you tend to find as the sarcopenia happens. Sarcopenia happens to all of us, by the way. You lose 3% from the age of 25, 30, basically, but 30 to about 60. From 60, you are losing about 15% per decade of your muscle mass. And guess what is filling the space where you lose the muscle? Guess what's filling that space? Somebody have a guess? Fat. Edith, you got it. Exactly. Fat is filling that space, right? So now you had a nice, toned muscle. It becomes saggy and loose. Why? Because the muscle mass has been replaced by the fat. Now, what are the things that will impact, that will influence you entering into normal, natural menopause? Number one, genetics. Like I said, us African and Black people, we go through it earlier. Our sisters in India and Asia, they go it much, much quicker. However, if you actually look and see, they are the countries that have the highest rate of diabetes with the lowest rate of obesity. Why? Because they're insulin resistant. So the insulin resistance really does play a part in it. In as much as we blame the genetics, there's also that part of what is our metabolic health doing. If you don't have any children, your risk of going into menopause early increases by 4-fold. If you have your periods before the age of 12 years, which is happening to a lot of young girls right now, their risk of going into menopause early increases 2-fold. If you have a cycle that is less than 26 days, same as you, number of births you've had. So if you've had more than 3 births, you tend to have more symptoms and likelihood you will go into it more, right? I didn't make these things up. This is research, guys, right? Don't shoot the messenger. I'm just here to deliver the information so you now know, right? Know where you stand, basically. Your race and ethnicity. If you are underweight, if you have poor metabolic health and you have metabolic syndrome is a class of 5 things. Fatty liver. You have abdominal obesity, that fat around the belly, right? You have high blood pressure. you have high cholesterol, and especially the triglycerides, and then you have low HDL, the good cholesterol, and you have high LDL, and you have insulin resistance, right? Those 5 things. So which also puts you at a risk of obviously having a stroke, myocardial infarction, heart attack, myocardial infarction, a stroke before the age of 35 years. So if you had a stroke or you had a heart attack before the age of 35 years, it's highly likely that you will go through it earlier, right? If you're a smoker, because remember we said if you smoke, you're losing 2 years of your ovary life. So that means you are likely to go through it early. If you've been abused, this is something that women don't think about. This is why it's so important to get the help that you need, because if you don't deal with this abuse and trauma, you will go through it 9 years earlier. 9, guys, 9. It's huge. And if you've been on oral contraception, especially if you started oral contraception so say, for example, in your 30s, than if you started it in your 20s, right? There seems to be a correlation between the age with which you start the use. And of course, I did say earlier, of course, there is other unnatural things, like if you have medical causes of going through early menopause, would be like chemotherapy, radiation. If you have premature ovarian insufficiency, if you have a hysterectomy, if you have a oophorectomy where they take away one ovary, those kind of things would obviously, those are the unnatural ways, but they're also important for you to know, because when they go and tell you about these surgeries, you need to understand how will this impact me. So this is just a summary of what we've talked about. Pre-menopause, the normal productive life age, when you're most fertile, most we have your most eggs and good quality eggs. Then you have your last regular period. We say regular period because now you've entered the hormonal chaos point where it's all over the place. And then you have your last period, and this is mentioned by having that 12 months of consecutive no periods. And then that's what we call like menopause. So that 12 months of you not having periods, that's the menopausal part. And then postmenopause is the rest of your life until you die. Different symptoms will show up at different times. If you're pre-menopause, you will tend to have PMS, and 70%, 75% of young women, like in their reproductive age, go through it. It is common, but does it make it normal? No, right? Then there's the peri-menopause. We'll talk about this in a bit more detail, and we'll also talk about this in a little bit more detail, because we did say that you losing the estrogen really does have a big impact on things like even vaginal infections, urinary infections, and like depression and all those things. This is your estrogen, guys. In your 20s, you're here. In your 30s, you're here. 35, full. You are a full bottle. Yeah, 40, it starts coming down. 50, and then it's going down. By the time you're in 80, it's by your ankles. Technically, it's like I look at it, it's like, you know, when you wear that socks that come to your shin, and then this one is like trainer socks. That's what it looks like to me, like trainer socks. So yeah, this is like thigh height boots, you know, off shoulder, whatever that they call it. So yeah, whatever you want to call it. Now, of course, there's always myths and facts. Some myths about menopause. Oh, menopause begins at 30. Peri-menopause could begin at 30, or even you could go to early menopause at 30, but there's a lot of it's rare, it's not very common, and there has to be a lot of symptoms. For example, you had a menopause-induced, medically induced menopause, those kind of things. But natural menopause does not happen at 30, right? Most people will go through from the age of 45 to 55. Those 10 years is when it will happen for most people, depending on your ethnicity and your metabolic health, I should add. Normal sex life, that's a lie. Yes, testosterone does go low, which can impact your sex life. However, it doesn't mean that you don't have any sex, like you're not dead. Come on, menopause is a disease. It is not a disease. It is a natural transition, right? Weight gain is inevitable. No, it is not inevitable. It does happen. You do increase your visceral fat from, say, 8% to 23% without a change in your lifestyle or diet at all. because now the estrogen is no longer giving the instructions of exactly where to save your where to save the fat. I'm so sorry, my 4-year-old is just entering.
Need a piece of paper. Thank you.
Just needed a piece of paper. All right. And then hot flashes is the first sign. It is a lie. In fact, hot flashes for most women tend to be like number 5. It tends to be like number 5 when the people who do like these kind of studies, or they see a lot of menopausal, perimenopausal women, they find that hot flash is not the number 1 thing that women will complain about. It's like number 5. However, it is the thing that has always been known by everybody. Everybody just think of menopause, and the first picture that comes to their head is hot flashes. It is a lie. It is not true. It is one of the symptoms, it's one of the vasomotor symptoms, but it is not the only one or the first sign. You could have other things. You could have vertigo. You could have a frozen shoulder. That could be. It could, the manifestation are physical only. It is a lie. There is a lot. There is a lot. Like, there's a lot of psychological, emotional impact that this has on a woman. And signs and symptoms can come in random. Like I said, it's a zone of hormonal chaos, so it can come at any point. But I thought I'll give you a list of some of them. There's somebody who mentioned, I can't remember who it was, who was mentioning this. These are some of the things. Hot flashes, of course, goes top because it's like the one that people most know about, most common. Night sweats, irregular period, loss of libido, vaginal dryness, mood swings. And then this is why I was saying the men need to be here, because they just see your wife's moods have suddenly changed and they're just thinking, oh, what's going on? It's because they are going through this transition. They're in a zone of hormonal chaos. So we need to be a bit more understanding and supportive. And then you get pains, joint pains, breast pain, burning tongue, electric shock, digestive problems, gum problems, muscle tension, itching skin, tingling in the extremities, your legs and your hands. And that's the one we're talking about, that crawling under your skin and that kind of thing. Changes that are happening, you have a lot of fatigue, you have hair loss. So if you lose hair in your temples, this is like male baldness, is mainly to do with the testosterone. If you lose hair here, then that tends to be the female pattern of hair loss, right? They have difficulty concentrating, they have brain fog, memory lapses, dizziness, weight gain, incontinence, bloating, allergies, brittle nails, change in odor, so like the body odor, irregular heartbeats, so you can start having like palpitations. Those are part of the vasomotor symptoms, depression, anxiety, irritability, panic disorders, and others are things like osteoporosis. Why? Because when you lose your estrogen, you lose your cardioprotective factor, so heart disease. You lose the estrogen. Estrogen is very anti-inflammatory, so you lose the anti-inflammatory effects. You lose your subcutaneous fat. That hips, the fat around the hips, and it moves and travels to your tummy, your belly, that muffin top. That's why, because estrogen is gone. Your skin and your collagen gets dry. You lose that elasticity. And your bone and your muscle health goes down because your testosterone also goes low. And now that puts you at risk of things like osteoporosis and sarcopenia. And then, of course, as estrogen decreases, you lose your muscle mass. Your basal metabolic rate goes down, which means you're not burning as much energy. And of course, this is where the weight gain comes in, because you're not losing as much energy as you used to. So if you continue eating as you were, then it's a problem, because your basal metabolic rate has actually gone down. You have increased insulin resistance, and you have decreased sleep, which of course affects your hunger hormone, so you're constantly hungry. Because when you don't sleep well, even naturally, when you're going through perimenopause, if you don't sleep well, the following day, the whole of that day, you're going to be insulin resistant. You will be hungrier, you want to eat more, you will not be the same as if you had a good sleep. So now you're having sleep that is disturbed every night. What do you think is going to happen? And then, of course, you're going through all these changes. So you're stressed. Your cortisol goes up. And when cortisol goes up, what else goes up? Insulin goes up. It becomes a vicious cycle. If you already had pre-existing insulin resistance, oh boy, now you're in for it. you will struggle with it because you're becoming more insulin resistant. And if you are insulin resistant, now there's so many other things that are going up. There's so many risks for all these diseases that are going up because estrogen supports healthy cells. And now we've lost the estrogen. So that support has gone, right? 40% of women in their 60s will still have hot flashes. And this is mainly to do with the insulin resistance. And especially if they were. Some of the symptoms a perimenopausal woman will have is the quality of sleep. Either they will have issues with inability and especially if anxiety is one of the symptoms they're going through, because then they can't calm their mind. You know, like normally when you go to bed, internet is unstable. Don't do this. When you go to bed, you need to like calm down your thoughts and kind of get the thoughts down, you know, wind down so that you can be able to fall asleep. Some of the women really struggle to wind down and like fall asleep. So that becomes part of the things that interfere with the sleep, right? Then, of course, we've talked about the weight gain. When we withdraw estrogen, that visceral fat goes up, like I said, from 8% to 23% without you changing anything. But of course, you can see all these other things like the lack of sleep, the fact that you've lost the protection from insulin resistance because estrogen has gone down, all these things, and the cortisol is going up. Like it's not a one thing, it's multifactorial. So the weight gain, that's why the weight gain comes. So you've got to know this. Now let's look at your brain. But let's look at the chart before we go to the brain. We're not even at midpoint, and I'm already Googling HRT. Okay, all right. The point is to give you information so you can make informed choices, right? Does menopause cause muscle cramps? Yes, because now you've lost that protection from the cells. So now there's a lot of things going on, and especially if you now combine perimenopause and like in nutritional deficiency, some of the times cramp is caused by lack of electrolytes in the body. So if you now combine the change in the body and the, you know, the loss of estrogen, you know, loss of hormonal sex hormones, let's call them that, then it can sometimes cause muscle cramps. But before, that's why I said you can't point everything to menopause. You first of all have to rule out other causes. Are you electrolyte deficient? Right? Are you magnesium deficient? Before we put everything down onto menopause, we have to have ruled out everything else, right? Yes, panic disorders. Yeah, panic disorders, very, very common. Gum issues once or twice. So you need to check, do you have gum issues because you're in that phase, or do you have gum disease because you have periodontal issues? Right? So you need to, that's where you see what you've been doing with your health before you get to this phase has created a baseline. Now you know, right? Like now I go to my dentist every 6 months, and every 3 months in between I go and get my teeth cleaned by a hygienist. Now I know my baseline. So when things change, or should things change, I am able to know. But the problem is we neglect having that relationship with our bodies before we get to this phase. So now when we start getting these things, we don't even know what is coming as a result of this, or what was already pre-existing, and it's just been made worse. You know, so it's really important for us to really know this information and understand where we are at, so that when we get there and things change, we are able to now know exactly how to go about it. Betty says sleep is a major one for me. Now I know I can't sleep and medicate it. Yeah, it happens a lot. I thought the temporal hair loss was due to braiding. You're not alone. Many women think that. Yeah, I've had dental issues before. Yeah, so it could be. So now you need to have that discussion with your dentist to find out, is it increased? Is it the same? Because of course, if you have periodontal disease can progress. You can have mild, moderate, severe periodontal disease, and your treatment for each stage is different. So is it moved stage, and is that based on your oral health and oral microbiome, or is it based on the fact that your hormones are changing? Because remember, teeth and bones are made from the same thing. So if you're having a lot of bone resorption because you're losing your bone mass, that could be affecting your teeth, and of course that's going to affect your gums. That's why your gums get affected. So we have to understand, like, you can't just take one thing only. You have to look at the whole picture. Now, estrogen lubricates your brain and it makes your brain work well. So when the lubrication goes, can you see that now we are going to have glitching and catching, and it's not going to work as well as it used to, because it was nice and smooth. It's like a car with nice and oiled parts. And then now the oil is gone, right? So a lot of women will start having issues with anxiety, depression, panic attacks, and this gets blamed to like a mental health disorder, when actually what they're starting to do is have cognitive problems because the lubrication is gone. 40% increased risk of mental health disorder. This is why I needed the men to come and hear this, because if you have 40% increased risk, if these women start having these brain symptoms and start having symptoms that present like a mental health issue, it's not just going to affect that woman, it's going to affect the whole family. The other thing is, when you produce follicle stimulating hormone, you normally produce estrogen with it. But now, because your egg count is so low, your follicle stimulating hormone is going so high, but your estrogen isn't. That on its own, it's toxic to your brain and it's toxic to your liver. So your brain is already experiencing toxins as a result of that elevated level of FSH. And this is what causes the plaque formation, and that increases the rate of Alzheimer's in women, because remember, the men are not having this. And if you go to a care home, you will find 66% of women in a care home, 66% is females, and only 33% is male. Did you guys know that? Who knew that? And then we have rebuked the devil for anxiety. Yes, I agree. Of course, there's always times when the devil is to blame, but yeah. Yeah, 66% of people, like residents in a care home, 66% is female. What are the main reasons that people go to a care home? Number one, mental decline with dementia and Alzheimer's. And number two, they have become frail. So musculoskeletal muscles, bones, and they can no longer be able to look after themselves. They can't wash themselves. They can't dress themselves. They can't toilet themselves. That's where they go there to be looked after. Guys, muscle is the organ of longevity. If you lose anything, not your brain and not your muscles. And then that's how to stay out of a care home, right? 80% of women will have some form of musculoskeletal syndrome. And for 20% of the women who have severe symptoms, this is their worst symptom. This is their most severe. Frozen shoulders are very, very common. Now, back in the days, I did physiotherapy for 15 years. How many women did I see who had frozen shoulders who were in the perimenopause phase? Loads. Did I know it then? No. Yes, of course, the frozen shoulder, you still, whether it's perimenopause or not, you still treat it exactly the same way. But the difference is that if you now have that understanding that this woman is coming as a result of the hormonal changes, it makes a very big difference in terms of even the way you're empathetic, even the way you treat her with understanding, because now you understand what is the root of it. Because at that point, you're just treating the symptom, the fact that they have a frozen shoulder, because you have to address the frozen shoulder. Because frozen shoulder comes in 3 phases. Phase 1 is extremely painful. That's the point where I would give them an injection, because it's extremely painful. Then you get the freezing phase, where the frozen shoulder is stuck. Even you and the physio can't lift it. And then phase 3 is, we call it the thawing stage, because it's like something that had frozen and is now thawing, so that, like when you freeze your chicken and now it's thawing, so that you can now cook it. It's like that. But is the thawing quick? Of course not. It takes years. Sometimes it can take years. Sometimes it can take a year. It can take months. Depends with obviously you. Sometimes you have to go and have manipulation and anesthetic for frozen shoulder, where we do a hydrodilation where we put liquid to break up the adhesions. But why did the adhesions come in the first place? Because estrogen gives your tendons that elasticity. It gives it that ability to be able to expand and contract, right? When you lose the estrogen, everything becomes stiff. It becomes tight. the tendons are no longer as healthy as they used to be. The inflammation in the tendons and the joint goes up. So now women suffer so much with it because of that. And guess what? 50% of women will have an osteoporotic fracture before they die. Men don't do that. They don't have that. Why? Because when you go through sarcopenia, you lose your muscle mass. You also lose your bone mass. The sarcopenia, the osteoporosis happens. You have brittle bones, and now you're at risk. God forbid you fall and break something. It could kill you. It's most women will go and have a fall, and from a woman who was independent, they are no longer able to look after themselves. They're no longer able to do that. Then some of the other symptoms are things like hair loss. I mentioned the male pattern baldness, temple, widening part, women, because hormones contribute to hair loss when you receive excessive amounts. For example, people go and have testosterone replacement, they have too much, then it causes them to lose the hair, right? Or sometimes you're converting, you have too much aromatase in your body, which is the enzyme that converts your estrogen to testosterone to estrogen, and it's converting it to testosterone. Then that can cause that. That's you start having hair where you don't want hair and losing hair where you want hair, right? And also your steroid hormone binding hormone, globulin, it's a protein that carries your sex hormones, right? When you have decline in your estrogen, that estrogen stimulates the production of that hormone. So you see a lot of the androgens are like your male hormones, DHEA. Somebody's speaking, I'm just going to mute them. And it increases the level of that hormone, which can lead to that hair loss. So yes, hair loss can come as a result of you losing the estrogen, because estrogen stimulates that. And so you get a lot of androgen activity. It might not be producing a lot, but it's a bit more active. Now, I left this picture in this colorful way so that you can actually see it rather than turning it green, because I want you to actually see the difference between what happens to you before you go through perimenopause, menopause, and what actually happens to you after menopause, right? So this is you have a nice, healthy, beautiful, plump ovary, nice, healthy, long uterus, vaginal lining is thick and moist. The walls are nice and elastic. You produce enough lubricant, so you don't need any external lubricant. And look at you here once you go through menopause, right? The decline of the hormones, this is what it does to us. Look at the size, compare with that size. Can you see this? Can you see this? This is even the length. It has shortened, right? This is farther apart. Divorce has happened over here. Here they were in honeymoon. Here there is divorce, right? Can you see? The difference is huge. Look at this. Look at this. So now you wonder why the libido goes low, because first of all, having sex is not exactly as pleasurable as it used to be, because it's shortened, it's thin, it's dry, right? You're constantly having vaginal infections. Why? Because the pH, even the pH changes. So now the vaginal microbiome has changed. It's being impacted on by the decline in those hormones. And then now you get more vaginal and bladder infections, right? You start leaking of urine. Because remember we said about that sarcopenia? Do you think your pelvic floor will be spared from the sarcopenia? It won't be. So the control is now impacted on. So you end up having less desire, less arousal, less orgasms. Why? Because the hormonal changes have actually led to an atrophy of your organs and the structures. It's real, guys. It's coming. Estrogen goes down about what? 35% between the age of 35 to 50. But look at progesterone, 75% between the same age. Because when this is impacted on, then you don't ovulate, you get less and less. The less eggs you have, the less ovulation you do. And like I showed you, Only when you ovulate that you produce the progesterone, because now if you don't ovulate, you don't have any corpus luteum to produce the progesterone. And that's why it declines as significantly as it does. When you have, some people will have prolonged symptoms of perimenopause. Why? They have what we call a rushing woman syndrome. They are stressed. They have so much on their plate. They never get any me time. They don't get to calm down and chill out. They have a poor diet, so they have nutritional deficiencies. The lifestyle they're living is not supporting where their body is at that time. They have a lot of chronic toxin exposures. Their toxic load is huge. They have issues with their gut, and as a result, they have chronic inflammation, which leads to other problems. They have a sluggish detox system. And remember, I told you the high amount of FSH is toxic to the liver. Your liver is the main detox organ. And then now you have a sluggish liver. So your detox for the whole system is low, it's poor, it's sluggish. Now we have problems everywhere. And then because hormones don't work in isolation, they work together as a team, your thyroid and your adrenals are now impacted, and especially because you have insulin resistance. This is a summary of everything that estrogen does in your body. Your heart, your liver, your bones. That's why, by the way, a lot of women find that their cholesterol levels, you've been nice level of cholesterol, and then boom, it goes up all of a sudden. And then your GP wants to put you on statins because your cholesterol has gone up significantly. Why? Because you've lost the estrogen, and estrogen was controlling this cholesterol production in your liver. Your bone strength, your bone density, your skin, anti-aging. Now we start having wrinkles because we are losing that elasticity. That collagen is impacted on. Your brain, your libido, your ovaries, your breast. And then now you start wondering why your breasts were nice and erect and now they are bowing. They are saying, Jehovah, you are Lord. Yeah, you could tuck them in your skirt. If you wore a high-waisted, if you're wearing a high-waisted skirt or trousers, you could tuck them in. Whereas before they were like, yes, we are here. And then now, why? Estrogen, we're going to miss estrogen, aren't we? And progesterone. And then, of course, with your uterus, I've shown you what happens with the changes that happens to the actual structure. Yeah, waiting for the good news now. Yes, there's good news. Yes, there's definitely good news. You're right about that, right? Menopause has no balance. Tanya, you are so right. I don't want to miss anything. Please give us an idea of the remaining time. Oh, no, we're almost done. This is like towards the last slides. Don't worry. We are almost done. That's why we said we are coming to the good news, yeah? Okay. Now, where are the men? I put this for the men. Why? Because this is, okay, you can pass the information to them because I don't see the men. Pass the information to them. Tell them what they need to do to support you. Number one, they need to validate you. They need to say, to have that point of, I hear you, I see what you're going through. I hear what you're going through. I understand. I'm going to be calm and chilled. I'm not going to judge you for what's going on, right? They need to be educated about this because guess what? All that information we've talked about, if they don't know it, how are they going to understand, right? And then they need to work with us. Let's figure it together. Let's go to the appointments together. Let's make the decisions that are relevant for our health together. Because guess what? It's going to affect them equally as much. Now, I, as Yunis, want to help you to have a good transition. I want you to be a warrior, not worrying about it. I want to help you make your health span equal your lifespan because I've shown you that it's not just going to affect you from hormonally, it's going to affect like the rest of your life in terms of your cardiovascular, your mental health, your bones, your joints, your everything, your other hormones, your insulin resistance, and your risk of disease and mortality altogether. I want you to live at ease and not with dis-ease, right? This is a testimonial from one of my ladies. Her name is Jane. She said, I started going through menopause a couple of years ago, which was induced by treatment. My symptoms were mainly hot flashes, especially in the nighttime. It felt like a sudden surge of heat would arise in my body, all the way down to my toes. It affected my sleep and I had to leave a window partially open so as to cool down. Having a hormonal session, imagine you are the man and now this woman wants to leave the window open in winter. Yeah, or put the fan on. because they are burning up. You know, the men think it doesn't affect them, but it does. Having a hormonal session with Yunis, actually, she didn't just have a hormonal session, she had everything. Was beneficial in helping me manage my symptoms, helped me to manage other symptoms that arose from lack of sleep. I also learned to manage my stress better, sleep hygiene, eating healthy eating choices for my menopause, and benefits of physical activity in reducing the symptoms. One would think that as a nurse, which is a nurse, I should already know everything. Through this, medical science does not into natural ways of sorting issues out. They always look into medicating everything. That's it. We name it, we blame it, we tame it, right? In menopause, medication can be useful, but it's not the answer to everything, right? There are lifestyle issues that, you know, things we can put in from a lifestyle perspective. I'm grateful for learning new ways of maintaining my good health. I'm now able to manage the hot flashes, even got more knowledge for holistic care. Thank you, Yunis, for your dedication in knowledge of health. It has given me hope for now and for the future. And that is what I also desire for all of you. So what is the good news? This is the good news. The good news is that we have a 6 weeks boot camp where we are going to look at everything you need to know and do for your menopausal symptoms, because we are not looking at it just on menopause. We are looking at it as you as a person, as your health. Everything, every system in your body will be addressed, not just your menopausal symptoms. We can't address one thing. Your body is connected. It works as a team. It doesn't work in isolation. So I want you to become a menopause warrior, not warrior, right? But doing this 6 weeks program will help you to address. We're going to tackle one thing every week, and we're going to nail it and get it like to a T, right? So what we are going to do is get to the A to Z of the things that we need to do. Now, I need to know who is keen to do this. So what I'm going to do is I'm just going to send a link over here of anybody that wants to do this. It is not expensive, by the way. It is only £47. And maybe somebody can help me look at how much that is in your currency. I'll put this here on the chart. Oh, wrong thing. There we go. So that's the link. This is the, oh yeah, thank you. 7,950 Kenyan shillings. Anybody else in a different country with different currency, please put it on there. It is only £47 for 6 weeks. So basically £8 or less than £8 per week, if my math is right, ish, something like that, right? But for out of that, you're not just going to be learning about your menopause only. You're going to be learning about how to address the whole of your health, the whole of your life. Because guess what? There's life after menopause. If you go through menopause at 50 and you live to 100, you have another 50 years. And if you've lost the estrogen and you need to know how to manage all the symptoms that come as a result of the estrogen, they will have an impact on your muscles, on your bones, on your brain, on your other hormones, right? It will have an impact on everything you do from that moment onwards. And so we are actually talking about from 40, because most likely if you start going through perimenopause at 40 and you start having these symptoms, estrogen is declining. So all these things are starting. Your risk, your cardiovascular risk goes up significantly. So your risk of having a heart attack, your risk of having a stroke, your risk of having Alzheimer's and dementia goes up significantly. So we are not talking about just your hormones. Your hormone is what is the root. The impact, however, will be much greater. And I don't know who asked what time we're going to be finished. We finished. So I think for me, it's basically about you being a menopause warrior, not constantly worrying about it. And 6 weeks, in that 6 weeks, we are gonna like look at everything. We're gonna look at nutrition. We're gonna look at sleep. We're gonna look at stress. We're gonna look at exercise and movement. We're gonna look
your
at...
WhatsApp.
Sorry?
Yunis, remove your WhatsApp screen.
Oh, sorry. Thank you. Thank you, Edith. Right, can you guys see this back? The menopause warrior? Yeah, perfect. Okay, so that's the solution. The solution is because initially I was going to just do a teaching, but I realized that for the amount of work we need, because this is not just about learning, it's about doing, right? It's about learning how to structure your meals to support your body the way it should be supported for the rest of your life. It's about learning which kind and form of exercise and what intensity and what length of time you need to be doing it to help you with that. It's about learning how do you put a sleep hygiene that enables you and helps you to actually be able to sleep well. So because your body repairs when you sleep at night. So you can repair your brain and you can repair your body. It's about making sure that you don't end up in a mental health unit as a result of what has happened, the withdrawal of estrogen from your brain. That lubrication is no longer there. And what else can you do to support everything else? It's about managing your weight because now your weight has shifted from your hips to your belly. It's about managing that visceral fat. It's about reducing that visceral fat. It's about reducing the risks that come. In fact, if you become obese and overweight, you are at risk of 13 types of cancer. It's about reducing your all-cause mortality for all these diseases that come as a result of that. And so that's why we have to address each and everything. It's about talking about what supplements can support your body. It's about talking about what things do you need to implement in your life, what self-care looks like for you, because you need to slow down. That rushing woman syndrome has to go. Right? But you need to understand how to do this. It's not a one-day thing. It's not a 1-hour course. It is something that you have to learn about it, understand it, and do it from understanding, and now consistently do it throughout your life. Now, I know there are some people here who were invited by others. I'm going to give you, oh, I need to put this plus for thing. I'm going to give you my phone number if you feel like you would like to discuss other things with me, because it's not just about menopause. I am a healthy life specialist. I help people reverse diseases, metabolic diseases especially, and prevent diseases. And so it's not just about that. And also, can I ask, does everybody, well, probably not, because if you're coming for the first time. So if I put my social media handle, it is the same everywhere on any social media handle. If you are here, please follow me. Please follow me on social media. I put out a lot of value posts. And also, if you can contact me and let me know, like, anything that you'd like us to discuss, I do give you a free consultation. So I can send you the link for that if you contact me on that number. This is my social media handle. So please do follow me. This is my phone number. WhatsApp me. But now, before we go to anything else, I need you guys to let me know, what was your biggest takeaway? What was your takeaway? You can say it live,
Everything.
or you can text it in the text in the chat, and I'll say it. Edith, go for it.
Everything. At least you've confirmed a lot of things that let's say I just turned 60 last year. So a lot of the things you've said are very, very true. And because, it gets you worried. And so I'll definitely, let's say, register for this course. I think it's something that I'll really benefit from. Thank you.
Perfect. Thank you. Amazing. I hope you've got the link. Yeah, although anyway, I've got your number, so I can text you that. Perfect. Betty, go for it.
Well, okay, so at least I know I'm not crazy.
No,
I
you're
still
not.
love my family.
Yes.
I am assured. I still love them. Even the one who is on this platform, I love you. Yes, yeah. So at least I know I'm not crazy, and I'm happy to know that there's so much more to this than just hot flashes and anger.
Yes. Yeah.
Very helpful.
Absolutely.
I have registered.
Perfect.
I'm ready. Let's do this.
Yes, let's do this. I'm ready. It is one of the things that I love, seeing somebody's health transform. Like for me, it's like your numbers transform, and I'm like, so thank you. Thank you so much, Betty. Who else? Who else wants to go? LM. We can't hear you. I think maybe your volume is a bit low for the speaker. I'll read what, while you're fixing your speaker, Josephine said, the aspect of sleep and loss of concentration with the lack of brain lubrication was the thing that stood out for her. So that was Josephine. Modoni said, the link between estrogen decline and the entire body health, brain, bones, and cholesterol. Absolutely, yes. For me, the thing that shocked me was one, the decline in the egg, and number two was the fact, the frozen shoulder, because I've been a physio, like that got me. And I was like, oh my God, I was doing my ladies a disservice for not actually educating them why they were getting it, you know. But I treated that based on the information I had at the time. Thank God for functional medicine. It teaches you things that nobody else teaches you, you know. So it's those things that really got me, and like how much it really changes your health profile for the moment you lose it. I'm like, oh my God, wow. Like women are so different from men, so different. Ellen, is it working yet? Let's see who else. Evelyn raised her hand. Evelyn, go for it.
Hey everyone, and Eunice, thank you so much for always giving, going above and beyond. I think my shocker is that 66% of people who go to homes are women. I mean, that is really, really high. And if we knew this information early, if more people know it, we can decrease those numbers, because that's huge to know that it's women who get affected more than men do.
Yeah, absolutely. Yeah, I think that made me sad more than anything. It made me quite sad. And you know, the amount of risk of mental health diagnosis. I've worked in a mental health unit for 3 years. And I look back and I think those women that were there, they were in that middle age. I'm like, oh my God, they probably just had estrogen decline. And then we are pumping them all with all these antipsychotics.
Yeah.
No, I'm like, gosh.
Yeah. Ignorance is very, very expensive when you don't know. Lack of knowledge, it's very costly, I think.
Yeah, absolutely. I quite agree with you.
I have a friend of mine that I invited, and I'm gonna read her text message to me. She has said, I know she doesn't mind. She has said, hold on. First of all, she said, I'm sitting here laughing. Like this needs to be taught to us in our 20s. So we are ready for peri, and menopause itself. We've not been given tools in time or enough information. You know, so the same way, I think somebody said that earlier, and you said it's the same way we're not taught about money in school. We're taught math, but we're not taught about money and money management. You can imagine millions and millions of women who don't have this information, and they're suffering, not knowing what's going on with them.
Absolutely. Thank you. And thank you for reading that. Wow, amazing. You know, it's if we have information, we have informed choices. We can make informed choices for everything in our health. And you know, like she said, if we are taught this in our early years, our early 20s, first of all, we as parents need to know it so we can help our children not to go through, like to start their periods early, because you can see that will impact how early they will go through menopause. You know, so us knowing the things that cause our kids to have early periods is a big thing. So it starts right from the beginning. Absolutely. Tanya, go for it.
Oh, hi, Eunice, and hi, everyone. So
Hi.
what you have been talking about today is really valuable. This week, my pleasant surprise was that my ears were just itching all the time. And then I discovered that that is yet another weird symptom of menopause. But I think fundamentally what's really, so one, I struggle to see the silver lining in this whole menopause process. And then secondly, it's the recognition and the realization that no one in the health space, whether it's the big funds or big pharma, are going to invest any money into menopause. And when I asked some of the really large funds across the world, what people told me was, menopause is not life-threatening. I guess it's the same thing that we dealt with when we were having like the dysmenorrhea and the painful periods and everything. It's not life-threatening, but sometimes I wonder, are women perceived as, I don't know what that is about, but I feel like women are perceived as such. We are like beasts of burden. So whatever discomfort it is we are going through is not taken seriously by anyone, and no one really invests into it. So I really, really do appreciate the women and the men who actually invest in this space. Ideally, it's mostly women. Definitely going to sign up for the boot camp. But yeah, I'm still waiting for the silver lining to this menopause. But yeah, every week it's just a surprise. Half the time you go upstairs or you go outside and you know what you are going to look for and you can't figure it out, and then you go back and sit and then you remember. So then you walk again and you go and try to figure out. So every day is a new and interesting and weird and surprising symptom. But I suppose with the help of people like you, we can navigate it a little bit better. I don't know how, but I think it would really make a lot of sense to find a way to publicize this information to women so that they can start taking preemptive measures before they actually get into premenopause or into menopause, because we are now living in an information age, which means that we've gotten to know a lot about what to do and that their potential. But it would be great for people to know ahead of time, just so that when they're getting there. And then I don't know, I don't think there's a single man on this call, and I don't think this call was predominantly for women, but I don't think a lot of men really know what we go through unless they're like in the medical profession. So yeah, thank you, and thank you for sharing. And I look forward to seeing you on the bootcamp. Maybe you can let us know the dates that it's starting.
Yeah. So somebody actually asked that question. So the bootcamp starts in September. So we're going to do the whole of September and 2 weeks into October. We will agree based on the people that sign up, will then agree on the day and the time, because obviously I want to see who is in what time frame so that we can try and work out a time that works for everybody, because we are all in different time frames. So that's why I haven't given the dates and the times, because it's something that we will agree together. But it's going to be from next week, so September, going on to mid-October. So we'll do that for 6 weeks. So that's the period that we're going to do it in. So the times and dates we will agree on, right? Now, this is something that I'm going to put on my YouTube. So please feel free to forward to anybody you know that would benefit from it. I always put my masterclasses on my YouTube. I do teach a lot about different things. Literally, I teach about a different topic every month of the year. Next month, I think it's diabetes, and the month after that is blood pressure. So I do a free session. So I think it also us as women looking for the information and finding out things like this, because I do publish it even in places like Eventbrite and like anywhere I can publish it, I do. And I always ask people to share it. So please do share. Follow me so that you know what else is coming in the various months, so that we are able to live well at ease and not with disease. So thank you so much for that. If you go to, say, PubMed is where all the publications are made. If you search for articles to do with pregnancy and like preparation for pregnancy, how to get pregnant, how to stay pregnant, how to like postnatal, then you will find lots of information. If you try to look for articles to do with menopause and perimenopause, they are very, very few. Unfortunately, the way you've said it, it's like once you've been pregnant, had babies, it's like you don't matter. But guess what? We are going through menopause, say from the age of 45 to 55. Like that's half of our life. So what about the rest of our life? Does it not matter the same? So now the unfortunate thing is we have to advocate for ourselves. We have to fight for ourselves. We have to fight for our daughters. We are the people who will make the change. But you cannot tackle the society in one go. You have, we have to start with us, the people, the person in the mirror. So if you know the information, you work on you work on it with your sisters, you work with your friends, you work with your work colleagues, you work with your daughters and your granddaughters. You have now that knowledge to pass on to them, so that now they are no longer having to die young and prematurely. Do you know the percentage of people who die young and in pain is 63%? And I can guarantee you, probably out of that 63%, something like 50% is women, as we have seen from this, the numbers that we have seen today. So it's just my prediction. I'm not saying that's the number, but the number of people who die young and prematurely and in pain is 63%. That's a huge number. So we have to advocate for ourselves. We have to know the information for ourselves. We have to take the actions for ourselves. And unfortunately, that's where society, that's where we are at. It is sad, it is disheartening, but we have to start from somewhere. LM, is it working now?
Hi, can you hear me now?
Yes, we can.
Yay, finally I figured it out.
Yay.
Thank you. Thank you. I mean, I've learned so much. It's not even funny. It's a little bit scary, but yes, I've learned so much. And I thank Betty for sending me the link. I had not heard of you before, and I'm so glad. I will be following you. I mean, wow, I didn't know a lot of these things. It's crazy. It's crazy, but yes, thank you. Thank you for sharing the information. Really appreciate it. Yeah.
Absolutely. Thank you for coming. Even, you didn't know me and you came, so that's important. Yes. Thank you so much. I appreciate your time. Let's see on the chat, who else said, my biggest takeaway was how significantly the estrogen decreased the far-reaching comorbidities. Absolutely. Frozen shoulder was a big one. This from Lillian. Frozen shoulder was a big one for me. Next time I'll help to campaign for our men to join. Do you know what? Yesterday we had some men that came to meet in our house, and I came and I challenged them, and I said to them, guys, tomorrow I'm going to be talking about perimenopause and menopause. Please join, because you think it's a women issue, but it is a man issue. It will affect you more than it will affect her, because this woman will like do a 360 change, and you will not be able to understand her. And as you've seen, like what percentage of divorces is happening during this time? Are you surprised by it now? No. Why? Because these men don't understand us. They don't support us. They are not working with us. They don't even get what's going on. So we think the problem is the relationship, where it's what's going on with us that is now making us feel like, listen, I'm already dealing with so many issues with my health. I just can't deal with you as well. So the women just choose the way out of, I think I just need a divorce so I can just focus on me by myself. Does it solve the problem? Not really. What we need is our men to become educated on it. And guess what? None of those men are here, including my own husband. He's not here. There was football. Liverpool was playing. So I don't know what time this game was finishing. So I suspect they went to watch the game. But we have to teach them. This is what we'll have to do. We have to teach ourselves and teach them. Unfortunately. Tanya said about the silver lining. Now, silver lining is this. When there's this lady called Lisa Mosconi, you can read her book. She's brilliant. She's literally devoted her life to study perimenopausal women and brains and how our brains change. And what she's found is that actually what nature does, it prepares us to take on that leader of the family role, that grandmother role, where we are not much more wiser, we are much more caring, we are much more like the head of the family. I think it was one of my friends who was telling me that he's from Kenya. He's from Nandi, right? He was telling me that the women, especially the older women in the society, they are the heads of the family. They're actually the ones who call the shots. They're the one who determines what will happen in the whole clan or family or whatever. And that's literally what the silver lining is. Like, we are now being taken off the reproduction to now provide leadership to the family. And that is literally something she has done with studying lots of brain scans of all these changes. And from the conclusion was that we are being prepared for that grandmother leader role. That's the silver lining. So that's how nature intended for it to be. But of course, nature also did not, maybe we should blame it for this, did not look at what's going to happen in between that transition phase. So those are some of the things. Itchy ears, yeah, even vertigo, like the ringing in the ears. That's why I'm doing this. Ringing in the ears, tinnitus, is one of the symptoms of menopause. It can be one of those things that you get. Like, there's so many weird and wonderful, I don't know whether they're wonderful, but weird symptoms of perimenopause, menopause. Brain fog, yes, brain fog is a vasomotor. It comes together with the hot flashes and all those things. How estrogen affects the body, that was Fatuma's takeaway. I didn't know a lot. Yeah, I really appreciate. You're very welcome. Yeah. Share with my daughter. Please do. Please do. Yeah, September we start the boot camp. I'm just going through the messages. Share the recording. So if you do want the recording, because I've recorded it on my computer, I have shared, this is streaming on YouTube, so you can go to my YouTube and view it from there. But if you want a recording for your own copy, I'm happy to share the recording. And even my previous masterclasses, I can share the recording with you. But because I'm recording it on my computer, not on the cloud, I need to send you the actual recording. So if you do message me, that's why I've given you my number, then I can send it to you. Yeah, the word menopause stays away the men. But guess what? They need to learn to work with it, because guess what? They have wives at home, they have daughters, they have work colleagues, or they have business partners, or they have customers who are female. So they can't get away from it. It is here to stay. Every woman will go through it at some stage. Whether they have symptoms or don't, they will go through it. So they have to learn. Life-threatening is only that which can reduce a man's life expectancy. I know, patriarchy everywhere, absolutely. The rage and short fuse I have demonstrated in my household. Yes, absolutely. Yeah. Do you know what? The other time I shouted at my daughter, at my son, and I was like, oh my God, am I going through menopause? You know, you start, because you know this information, you start thinking, okay, catch yourself, see if it's happening too frequently, start knowing where you are. I'm that age, so I'm going to be like 40 in 2 years' time. But then, of course, we've seen some of the things can start happening from 35. So, you know, it's having that knowledge and being able to share and be self-aware. The self-awareness is huge. It's called sensitivity a symptom, like in the course wearing a sweater. Now, coldness can be linked to your thyroid function. So if you have a thyroid issue, you'll notice you have cold extremities. Your hands and feet are really, really cold. You're very sensitive to cold. So although it might not be directly linked to the menopause, it could be that the loss of estrogen, progesterone, testosterone has now, because that happens a lot. You don't just lose only one thing. It doesn't only affect one thing, it affects everything. So it can affect your thyroid function. That's why I said when you go for your blood test, your doctor needs to first of all check, do you have an underactive thyroid, which could be causing you to have those symptoms. So it's very important for you to get that checked. Check your thyroid, get your thyroid checked before you start attributing it to do. Because remember, with the perimenopause, most of the time you tend to be more on the hotter side than the cold side. Rigid jaw, TMJ issues, yes. Menopause, yes. The answer is yes. Yeah, lots of issues with your temporomandibular joint, or we call it TMJ. Lots of, like, it gets stiff and locks, and like sometimes even chewing becomes really difficult. Yes, it is. Yes, Maggie, yes, thank you so much. I hope you've taken the number. I hope you've taken the link to sign up for the bootcamp. I am looking forward to doing this, because 6 weeks, we're going to learn about what we need to do and how we're going to address this. Yeah, half of it in March sounds okay. Perfect. All right, then. Super. So, ladies, I think I have taken 1 hour 54 minutes of your time, and I really appreciate you for staying this far. Thank you so much for coming. Thank you so much. Please share the link to join the bootcamp, even with those people who didn't come. If you know they will benefit from it, please do share with them. Reach out to me. You have my number. I'm easily accessible. I love voice notes. So if you send me a message and I respond with a voice note, I love voice notes. It's just, I like talking. I'm lazy of typing, so I prefer just voice noting you. So thank you, everyone. God bless you. Thank you so much for your time. I appreciate you. Please pass it on to others that need this information. Let's do this together. Let's get educated together. All right. Unless anybody has anything they want to add or ask or comment, then I believe we can log out. I can end it. Going once. Going twice. You're very welcome. Going thrice. Bye, everyone.